We all know that our health systems had pre-existing cracks of all kinds, but in Canada, as in the rest of the world, the COVID-19 pandemic has really forced those cracks into chasms.
I think the concept of universal healthcare system is what we aspire to, but I think we all knew in our gut that we didn't have it.
We've left a lot of people by the curb, mostly elders in institutional care. That's not really part of our Medicare system.
Some services are not covered, especially when it relates to mental health support. With the COVID, that's been very serious because a lot of people are suffering from depression, anxiety.
The challenge to us then is going to be, how do we rebuild systems that are stronger and more equitable?
I think in Canada, we have the least universal healthcare system in the world. So to me, I think we have to expand this Medicare basket make it much more large, and perhaps in the process, make it a little less deep.
One way to make the system more patient-centered is to invite more patients' voices onto the table.
To me, the ideal health system begins with the broadest possible definition of health and an acknowledgement that all of the decisions that we make in public policy and in the private sector ultimately have an impact on health.
I think we need to go back to the basics and start to really root out institutional racism within our healthcare system and start to erase the past by going forward in a healthcare system that treats every citizen, every individual that walks through our doors with respect.
Will the pandemic be severe enough that it finally gives us the impetus to act? I hope so. If I take the example of elder care, if 16,000 dead doesn't bring about change, I'm not sure that anything ever will.
We've shown that we can unjam these log jams and actually create really rapid and effective change. The question is, how do we maintain that momentum?